It is said Vusamazalu Credo Mudwa could resurrect the dead. Let us explore the remedies and plants he was using.
Prostate cancer is one of the most common cancers affecting men worldwide, and its impact continues to grow as populations age. In Africa and among men of African descent globally, prostate cancer is often diagnosed later, progresses more aggressively, and carries a higher risk of complications. This makes education, early awareness, and supportive care especially important. In this episode, we explore prostate cancer through a holistic and integrative lens. We will look at what the prostate is, how cancer develops, known risk factors, early and advanced symptoms, and how traditional African medicinal plants have historically been used to support prostate health, immunity, inflammation control, and overall resilience of the body. These plants are not presented as cures, but as supportive agents that may be used alongside medical care, lifestyle changes, and professional guidance. Understanding the prostate gland. The prostate is a small, walnut-sized gland located below the bladder and surrounding the urethra. Its primary role is to produce seminal fluid, which nourishes and protects sperm. The prostate is highly sensitive to hormonal signals, particularly testosterone and its more active form, dihydrotestosterone. As men age, changes in hormone balance, inflammation, oxidative stress, and cellular damage can affect prostate tissue. In some cases, this leads to uncontrolled cell growth, resulting in prostate cancer. What is prostate cancer? Prostate cancer develops when abnormal cells in the prostate begin to multiply uncontrollably. Some prostate cancers grow very slowly and may never cause serious harm, while others are aggressive and can spread to surrounding tissues, lymph nodes, or bones. The challenge with prostate cancer is that early stages often produce no noticeable symptoms, which is why routine screening becomes critical with age. Risk factors for prostate cancer. Several factors increase the likelihood of developing prostate cancer. Age is the strongest risk factor. The majority of cases occur in men over 50, with risk increasing significantly after 60. Genetics and family history play a role. Men with a father or brother diagnosed with prostate cancer are at higher risk. Ethnicity is important. Men of African descent have higher incidence rates and more aggressive forms of the disease. Hormonal influences, particularly long-term exposure to high levels of dihydrotestosterone, may contribute to abnormal prostate cell growth. Chronic inflammation, metabolic disorders, obesity, and diets high in processed foods and low in antioxidants are also associated with increased risk. Symptoms and disease progression. In early stages, prostate cancer may not cause symptoms. As the disease progresses, men may experience difficulty urinating or weak urine flow, frequent urination, especially at night, pain or burning during urination, blood in urine or semen, pelvic discomfort, erectile dysfunction, lower back, hip, or bone pain in advanced stages. Because these symptoms can overlap with benign prostate enlargement or infections, proper medical evaluation is essential. Conventional medical management. Brief overview. Medical management may include active surveillance, surgery, radiation therapy, hormone therapy, chemotherapy, or a combination of these approaches. Early detection allows for more treatment options and better outcomes. Traditional and herbal approaches should never replace medical diagnosis or treatment, especially for cancer. Their role is supportive, helping the body cope with inflammation, oxidative stress, immune challenges, fatigue, and treatment side effects. Traditional African perspective on prostate disorders. In many African traditional medical systems, prostate conditions were not named as cancer, but described through symptom patterns such as blocked urine flow, pelvic pain, weakness of male vitality, and wasting conditions. Traditional healers focused on restoring balance by reducing inflammation, improving circulation, supporting detoxification organs, strengthening immunity, nourishing depleted tissues. Several plants were commonly used to support men's reproductive and urinary health, particularly in later life. Key medicinal plants for prostate cancer support. Hypoxis hemerocallidea African potato. Hypoxis is one of the most researched African medicinal plants for prostate health. It contains phytosterols and antioxidant compounds that support immune modulation and reduce inflammation. Traditionally, Hypoxis was used for urinary difficulties, immune weakness, and chronic inflammatory conditions. Supportive actions. Anti-inflammatory, immune modulating. Antioxidant supports urinary flow. Typical preparation and dosage. Dried corn decoction or standardized extract. Traditional use ranges from 1 to 3 grams of dried material per day, taken as a decoction, under professional guidance. Sutherlandia frutescens cancer bush. Sutherlandia has long been used in southern Africa for chronic illness, wasting conditions, and immune support. Its traditional name reflects its role in supporting strength and resilience rather than curing disease. Supportive actions. Reduces inflammation. Supports immune balance, helps with fatigue and stress. Supports metabolic resilience. Typical preparation and dosage. Infusion of dried leaves. 1 cup taken once or twice daily. Capsules may range from 300 to 600 milligrams once or twice daily. Plantago species plantain. Plantago supports the urinary tract and mucous membranes, helping soothe irritation caused by inflammation or pressure on the urethra. Supportive actions. Soothes urinary tissues. Mild anti-inflammatory, supports elimination. Typical preparation and dosage. Leaf infusion or cold maceration. 1 to 2 cups daily. Bulbine natalensis. Bulbine has been traditionally used to support male reproductive strength and prostate health. It is often associated with vitality and endurance in older men. Supportive actions. Supports hormonal balance. Mild adaptogenic effects, anti-inflammatory. Typical preparation and dosage. Traditionally prepared as a decoction of the root, used cautiously and in small amounts. Professional supervision is strongly advised. Serenoa repens saw palmetto. Though not African in origin, saw palmetto is widely used in integrative prostate care and has become part of modern African herbal practice. Supportive actions. Supports hormone metabolism. Helps reduce prostate swelling, improves urinary symptoms. Typical preparation and dosage. Standardized extract. 160 milligrams twice daily or 320 milligrams once daily. Combining herbs safely. In traditional systems, herbs were rarely used alone. Combinations were designed to balance actions and reduce strain on the body. A supportive prostate blend may include 1 immune-supporting plant, Sutherlandia or Hypoxis. 1 urinary soothing plant, Plantago. 1 hormonal or vitality-supporting plant, Bulbine or saw palmetto. These combinations should be adjusted based on the individual's age, medical treatment, and overall health. Lifestyle and nutritional support. Herbal support works best alongside lifestyle care. Anti-inflammatory diets rich in vegetables and healthy fats. Reduced intake of processed foods and excess sugars. Regular movement and circulation supporting activities, stress management, and adequate sleep. Important safety considerations. Prostate cancer is a serious medical condition that requires professional diagnosis and monitoring. Herbal remedies are supportive tools, not substitutes for oncology care. Men undergoing chemotherapy, radiation, or hormone therapy should always consult a qualified healthcare provider before using herbs, as interactions are possible. In the next episode, we will explore prostate enlargement, a condition that affects many men and often overlaps with prostate cancer symptoms. We will examine how traditional medicine distinguishes between these conditions and how herbal support differs. Stay with us. The plants are still speaking.
If this video resonated with you and you feel curious to explore natural healing more deeply, you're invited to connect with Health Habits Holistic Care. You can visit the website to learn more or book an online consultation at your own pace.
This knowledge is shared in the spirit of remembrance. Plants carry wisdom passed through generations, and each body receives that wisdom differently. This information is shared for educational purposes only and does not replace personal medical care.